Okay, so you've just received a report from a genetic company, and it confirms that you're predisposed to diabetes. You've always heard that the price of insulin is very high, and diabetes can lead to kidney disease, heart disease, and retinopathy. But just take a breath. Let's unpack and make sure that we understand the meaning of predisposed. Predisposed simply means that you are at risk or inclined to. Being predisposed is not a diagnosis, but simply an inclination towards through genetics. According to the American Diabetes Association, type 1 and type 2 diabetes have different causes, but there are two different factors that are important in both. You inherit a predisposition to the disease, then something in your environment triggers it. Their website does a wonderful job of explaining how certain families are at higher risk for diabetes, but even if one identical twin is diagnosed with type 2 diabetes, the other one only has 3 in 4 chances of having type 2 diabetes. So just because one twin has it and they're identical doesn't mean that the other one will get it. Much more than genetics play a role in whether a person is identified in having type 2 diabetes. Some of the risk factors that increase the likelihood of developing type 2 include obesity, diet, and a sedentary lifestyle. Even though you have received genetic testing, it is not able to differentiate between your genes and your body's amount of insulin resistance or the amount of insulin your body secretes. Both of these factors are how type 2 diabetes develops, and the genetic test simply differentiates if you're inclined to it but it isn't able to tell us if you have insulin resistance or a decrease in the insulin secretion in your body. It just tells us that people in your family through your genetics are predisposed to diabetes. So what can you do with this information now that you know? That it's been identified that you have an increased risk of developing type 2 diabetes through genetics. The best remedy for you, or any human, is to make good lifestyle choices. Eat a balanced diet, and if you need help with your diet, reach out to a dietitian, find research from reputable resources. If you're not sure how to eat correctly, just reach out to those sources and try to figure out what are good things that you can be eating. Remain active. Don't let your life lead to a sedentary lifestyle. Whatever that means to you. If you ride a bike, ride a bike. If you like to roller skate, then go out and roller skate. Whatever keeps you moving at least 3 to 5 times a week for 30 minutes, do that thing that you like to do. Manage your weight. Although this is easier said than done, at least know where your BMI is and try to stay close to this number as you can by eating a balanced diet and getting enough exercise. Try to refrain from foods that are high in refined sugars. Lifestyle choices have been proven to improve glucose tolerance and levels and decrease the likelihood of developing type 2 diabetes.